The good thing with the baby Botox, you can even go closer to the eyebrow for nothing. So it's nothing. You already did it. So you did not. No, I have to.
Confident है. Confident. Procedure control है. कौन सा है? ये procedure का है क्या है? इसका मैं डॉक्टर वाला डॉक्टर.
Have 100
कौन सा
minutes.
procedure? ये
How I have to
स्क्रीन
do
टेस्ट के लिए
it
है क्या बोलते हैं?
with
मुझे एग्जैक्ट वर्ड भी पता चल रहा है.
with 4 ml. But this is a very good. You know, surgeons have always servants. Good. Are you fine? What are you expecting? You want to be more beautiful for the next party. But you know, even if you have some vessels, too much vessels, which is not already rosacea, if you have big pores, if you have acne, yeah, you can with baby Botox achieve really nice results. Yeah, and it is at least not really a dangerous procedure. It's very easy to do. If we get out the 4 ml of salience. if you put 2 ml. 4 ml, then 2, 3. So 2 to 3, so then we have 5. 5 ml, 50 units. In 1 ml we have how many?
10.
Did I ask you? Okay, so 10. And then in 0.1 we have 1 unit. And in 0.05 we have half a unit. And in 0.025 we have quarter of unit. So this is the amount which we are injecting. This is easily, if it is a little bit more, a bit less, doesn't matter. Yeah, in each of these squares. If there is infection, by the way, so I can save the time. And you put, you take out first. No worries, nothing happens at the moment. The good thing is, you will never see the result. And I will go home this morning. So, yeah, and they give me my you can take it. 30, but we had yesterday 40. Where do we have 40? Which one is exosome? It's already mixed. Already. The preparation is longer than the procedure. The good thing is, it's like in Latin America, yeah? Here in Pakistan, that's why I love to come here. You tell them how to prepare everything, and then they say, yes, 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 yeah, yeah, of course, yeah, 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 yeah. And then you are here, and you have to tell them, oh, I need this, I need that. So we have, you are right. But it's working anyway. It is a different way how to do it. So, okay. I'm using a 1 ml syringe with an extra needle. Yeah. Look, why I'm using this needle? For it has the 0.005 marked. And so if I need a quarter, I have the half of the way. So I can from 0.1 to 0, I can inject easily 4 different amounts, and that's why I'm using this needle. But you can, as you wish. Yeah. So you have a course or something. Yeah, this. So, okay, sir, we start. Okay. Are you prepared? This little meditation. So, and up and up and up. If it's a little bit more, it doesn't matter. But, well, 1 minute is already out. Yeah, it's just here. It's not really. If possible, intradermal. This is 4 millimeters. So it's a meso needle, but what? I go tangential. Hopefully, I am somewhere, but we are losing a lot. I don't know why. No, it's not too much, but it is too. So now, yes, okay. Now it's good. Okay. You feel pain? So, yeah, but you see, it's small bubbles. Yeah? It's not a big issue. If you lose a little bit of toxin, yes, most of the doctors are afraid to lose 1 unit of toxin. It's expensive. We cover a lot of money, so it doesn't matter. Yeah, yeah, that's true, huh? What? Yeah, but now you have to sell the skin booster. Yeah, it is not toxin, it is skin boosting. Yeah, anyway, compared to the costs, it is not if you lose some drops or even more, we lost probably 4 units, doesn't matter. And this you can do all over the face, yeah? You can do it from the mid-face, on the chin, everywhere, yeah? To be intradermal, epidermally, you have to use it like a fork. The biggest loose is the loose of the exosome. No, it's not the biggest loose, but there are how many? 430 million. Millions? Thousands? Millions! 430! I don't know who they count them, but of course, we believe it. We believe it. You know what? Okay. That's enough. Okay. So totally we use 10 units and this forehead is enough. Yeah. And you don't need to do more. Okay. And this you can do all around the whole face. Yeah. And then they will improve with their skin quality. We are doing this as fast, for we are here in this time shift. Normally it lasts much longer and then it's more precise. Good. The eyes is closed. Yeah, thank you. So that's all. That's all about. Oh, there are some reports where they tell us even, but it is not already in studies approved, that they now mix non-trusted hyaluronic acid with the toxin and they inject normally. So they inject it like saline solution, and they told us there were some doctors from Latin America, and they told us that it is longer lasting. Why? We don't know, yeah, but it seems something new. Yeah? And we will see what is the future. The future is also that in South Africa they have found a medicine or something which can reverse the toxin. Yeah? So by stimulating the SNAP protein 25, and so they can completely, they have already shown us videos, yeah, that they could reverse it even after 4-5 weeks. If you have an asymmetry, you don't, the patient don't like the look, and they can reverse it. So on this toxin science, there is a big change at the moment, and we are curious to know what the next few years will bring. You know, that's the most important thing, that we never stop investigating, that we always try to find out why something is working, why something is not working. At the end, we will also see what will happen with the exosomes and the polynucleotides. Yeah, at the moment, the science is very rare. Yeah, the science in wound healing is higher. We have much more clinical studies with polynucleotides in wound healing, in chronic wound healing. But in aesthetic medicine, you know, for approval, we only have 30 patients from multicentric studies, 30 patients from 60 institutes, you know, so something like this. So it's we have very low feedback what is true or what is not true, and you know, be careful what the industry is telling you. For we have always to think about before we are doing some procedures if it is not harming, and we not always have to be the first one to do it. Yeah. So let the centers do first the procedures and wait, and after 1-2 years you can start in your own practice to do the things what they tell us. Okay, thank you very much.